So Sam was a full-term baby, and we didn't expect there to be any problems. But at a year old, I started seeing a few differences that were a little concerning, but I didn't realize how concerned I should be. Having knowledge about developmental milestones would have been so helpful because, unfortunately, being a young mom, staying home with my children, and I didn't have a lot of kid experience or knowledge about typical development. So we lost out on 2 years of early intervention and access to services. And I think that it was just because I wasn't informed. I've learned a lot on my journey of raising a child with a developmental disability. And one thing that I've really come to realize is knowledge is power. And when you inform parents, then they have the ability to be a good advocate for their child and to help their children, to help guide their children to reach their greatest potential.
Today, 1 out of every 4 children is at risk for developmental, behavioral, or social delay. But the good news is this. Research shows that the earlier these delays are identified and children receive services, the better their outcomes. Unfortunately, many children experience lags in identification and early intervention services, like Alicia's son, Sam. This may be particularly true among low-income families and nutritionally at-risk children, such as those served by WIC. These children often miss out on critical services at a time when those interventions would have the greatest impact on their quality of life.
That's why WIC has teamed up with the University of Missouri to design a simple program that helps with monitoring children's developmental milestones. Milestones are how a child plays, learns, speaks, acts, and moves for his or her age. Using materials developed by experts at the Centers for Disease Control and Prevention, the WIC Developmental Milestones Program is focused on children, meaningful to parents, and easy for staff. And the program is free for local WIC agencies. Research shows that young children from low-income families and those with health concerns, such as low birth weight, slow growth, or high lead levels, may be at increased risk for developmental delay or disability. WIC staff may be among the first to observe these delays and refer for further assessment.
The WIC Developmental Milestones Program builds on the existing relationships WIC has with families, recognizing that WIC is a trusted source of information. The program fits seamlessly into WIC clinic flow. It can be linked to nutrition education, referrals, and participant-centered goals when appropriate. The program uses a positive, supportive approach to a sometimes difficult topic, and it is so simple that it can add less than 2 minutes to the WIC appointment. Perhaps most important, the program's positive effect on children and families has been well documented.
The WIC Developmental Milestone Program began as a pilot program shaped by WIC staff in St. Louis, Missouri. It was further refined by WIC staff in 4 counties with rural, suburban, and urban populations.
The campaign's primary messages to parents are: learn the signs of healthy child development, act early if there's a concern, and talk to the doctor.
Those messages are built into a series of age-specific checklists, ranging from age 2 months to 4 years. Each checklist is made up of a list of social and emotional language and communication, cognitive and movement skills that most typically developing children demonstrate by a specific age. The language is clear and simple. The layout is bright and inviting.
Well, when you give them that checklist, there is a definitive list. This is what my child should be doing at this age. This is maybe a concern. So they actually have this tool that they can check off and they can say, oh yeah, so my child's not doing this. Okay, this is something solid. This is something I can hand to my doctor.
The checklists are reinforced by colorful, family-friendly graphics on WIC clinic walls and floors. These graphics introduce key concepts of early child development in a fun, engaging way.
The impact of the program has been positive based on studies with WIC staff and families. Almost 100% of WIC staff said that parents were willing to complete the checklist, and nearly all parents reported that they learned new information about their children's development. In addition, WIC nutritionists emphasize that the program is easy to use, strengthens physician referrals, and empowers parents and staff. Most importantly, the program helps children get the services they need. We tracked 84 referrals, and 2/3 of those children were seen by their doctors because of the referral. Of those, 41% were referred for additional testing by another professional, and 29% accessed intervention services by the time the studies were completed.
It's important to note that the developmental milestones checklists are not screening tools, nor are they indicators of developmental delay or disability. Rather, this program is designed to monitor children's development and to help staff decide whether to refer to the child's doctor for developmental screening. Here's a snapshot of how the program works.
Parents routinely complete the checklist as part of the certification and mid-certification process. The checklist can also be used any other time a parent or WIC staff member has a concern about a child's development. When this can be done while staff is entering data, completing the checklist adds minimal time to the appointment.
Upon reviewing the checklist, if a nutritionist sees there might be some concerns, we can then fold it and put it in the WIC folder, hand it to the parent, and suggest that the parent follow up, and we refer to the physician for further information, just as we would refer for any other program or service in WIC.
The checklists are reinforced by colorful wall and floor blocks that can be used in waiting areas, nutritionist offices, and hallways, available in English and Spanish. These graphics are designed to start the developmental milestone conversation in a fun and inviting way.
Well, the children love the graphics on the floor. They are always drawn to the colors. The parents love it because they're getting tidbits of information, and we catch them all the time looking at the wall graphics and reading it.
Each staff member implementing the program, typically a nutritionist or other competent professional authority, will receive a developmental milestone toolkit. Each toolkit includes a series of 9 age-specific checklists in English and Spanish. Materials are currently only available in those 2 languages.
The checklist is very important. Each checklist is made up of 7 key elements. The age at the top, space for the parent to write the child's name and age, a brief description of developmental milestones. On the left, a list of milestones, things that most typically developing children can do by a specific age. On the right, in a purple box, a list of warning signs, indicators of possible concern. Resources for more information and screening in addition to the doctor. On the back is information to be used if a referral is needed. It provides language a parent can use when talking to the doctor and helps ensure that the doctor understands the child's possible developmental concern.
The checklists are supported by a downloadable implementation manual. The manual includes technical assistance contact information, instructions on how to install the adhesive-backed graphics on the walls and floors, and how to organize the checklists for easy use. 100% of staff reported this made the program easy to implement.
The program is so simple that it can be adapted to any clinic flow. But here is how it is typically integrated into certification and mid-certification appointments. WIC staff hands the parent an age-specific checklist to complete while the staff member inputs WIC data, thus taking advantage of some downtime in an appointment. If the child is between checklist ages, be sure to use the younger checklist. For example, if the child is 20 months old, use the 18-month checklist rather than the 2-year checklist. The parent completes a checklist for each child being certified or mid-certified that day. And the manual's talking point document outlines simple, clear language staff can use with parents.
Hi, how are you doing today?
Good, thank you.
Good. Okay, so how old is Addie?
Addie's 3 years old.
Okay, so first I would like to start with a checklist we have. And this is specifically for 3-year-olds. So this is just a checklist that we're using to help track her development, which is just as important as how we check her height and weight. So we definitely want to focus on her development. So I'm going to first just go through a couple of these just so you kind of get an idea for how this will work, and then I will have you fill out the rest of it. So, does Addie copy adults and friends?
Yes.
Okay. And does she show affection for friends without prompting?
Yes.
And does she take turns in games?
Sometimes.
Okay, just kind of depending. Yeah. So we'll check that since she is doing it some of the time. So do you have any questions, kind of how you'll fill this out with reading it, and just check mark it if she is doing it? If she's not, then you just leave it blank.
Okay.
Okay? And first, if you could, just make sure you fill out her name, age, and then today's date. And then I am going to work on the computer, so just let me know if you have any questions, okay?
Okay, thank you.
You are welcome.
Thanks for helping.
I'm going to do it.
After the parent completes the checklist, quickly scan it, counting any missing check marks on the left and noting any marked warning signs in the box on the right. Review the written comments section at the bottom of the checklist to determine if the parent has listed any concerns. This makes determining the need for a referral simple. When there are fewer than 3 black boxes missing checks, no purple boxes checked, and no written concerns, this indicates the child is reaching his or her developmental milestones.
Okay, all finished.
Great. Okay, so let me just check through this real quick. It looks like Addie is right on track for hitting all of her developmental milestones. If you ever do have any questions or concerns, though, about her development, just make sure you check with the pediatrician, okay?
Okay.
All right. Thank you for filling that out.
Sure you bet. Good job, Daddy.
When there are 3 or more black boxes missing checks, or 1 or more purple boxes checked, or written parent concerns about the child's development, this indicates the need for a referral.
So after reviewing this, I do think it would be a good idea to contact Ella's pediatrician just to follow up on her development. So I'm just going to fold this up, and then you can actually bring it directly to the doctor's appointment to talk to them about that. And who is her pediatrician?
Dr. Smith.
Okay. And then if you would, just let us know at the next WIC appointment how she's doing and what the pediatrician said, okay?
Okay.
Thank you.
Thank you.
The referral can be noted in the child's electronic file, and an alert can be set up as a follow-up reminder for staff. In addition, the parent can use the referral as the required goal for that appointment, if appropriate. This provides a ready prompt for staff to check back with parents as they return to the clinic to ensure that the child has been seen by the doctor.
It's important to note that the checklist review can count as a nutrition education contact when appropriate education on growth and development is included. There are many ways a WIC nutritionist or CPA can guide the discussion to include appropriate education. Here are some examples. Good nutrition is important to a child's physical and developmental growth. Would you like some information on how to incorporate WIC foods into your child's diet? Or, I know you want your child to eat foods that they need in order to grow, develop, and do their best. Would you like some ideas on helping kids learn to make healthy food choices? Or you can say, feeding your infant solid foods is not only about providing nutrition, but is also important for infant development. Can I give you some information on appropriate foods for your child?
All this information is outlined in the WIC Developmental Milestone Implementation Manual for easy reference. A key part of the manual is this simple talking points document with frequently asked questions. Generated from real-life experience by WIC staff, it contains helpful pointers about talking to families about sensitive issues, other screening options, and where to get more information. Backed by this support, WIC staff has reported that they feel comfortable talking with families about developmental milestones within a month of starting the program.
It's such a great way for WIC staff to learn about developmental milestones. Maybe they don't have any experience with talking with parents about how their child is growing and developing. And it's a really good training piece for new staff who maybe don't have any children and don't have any point of reference. It's also a very good, positive way for parents to learn more about their children and have something positive to focus on when they see that their child is doing very well.
And I also think it empowers the parent to and gives them courage to talk to the physician, whereas they may not bring up developmental milestones. Right. They might be more empowered to do that at their doctor visits and their checkups after getting those checklists from the WIC office.
Mm-hmm. Well, I think it's brought us a new perspective with our program that the whole overall health of a child is not necessarily just nutrition or their medical conditions, but also their developmental stages. So it just brought a big awareness to us as the staff that deal with children every day.
Well, I've had some really positive responses from parents that were able to take the checklist to their pediatrician and get their child into the service that they needed, and they were really grateful for the assistance.
All these WIC staff members have seen firsthand how the WIC Developmental Milestone Program has helped families in their communities. Now you are ready to join them. Whenever you need a quick reminder on program details, remember that all this information is readily available through the Implementation Manual, Talking Points document, and technical assistance. All are designed to support WIC staff in your mission of safeguarding the health of young children.